Hello and welcome. We are here with Chapter 9, The Joints of the Body. Okay, so a joint is contact between two or more bones, cartilage and bone, or teeth and bone. We can be classified either structurally or functionally. So structurally, is there a joint cavity and what kind of connective tissue happens to be involved? Functionally, what type of movement is permitted? Okay, fibrous is the first structural classification. So here we're going to see some sort of dense fibrous connective tissue. We have sutures, syndesmosis, and interosseous membrane. So a suture is simply a suture, the connection between two flat bones. Syndesmosis is going to be between, an example would be a gomphosis, which is between the tooth and bone. Interosseous membrane, these are sheets of fibrous cartilage. They are between the radius and ulna. We also see them between the tibia and fibula. Cartilaginous, you can guess they have some sort of cartilage involved. So synchondrosis and symphysis. Synchondrosis, we have no movement. So at the epiphyseal plate, we talked about this where we find growth of a long bone. Symphysis, fibrocartilage, there's some movement. So pubic symphysis, also the intervertebral disc between the vertebra. And then synovial classification, these are going to have an articulating articulating bones, freely movable, several ligaments to help stabilize these joints, and we have a synovial cavity. Functionally, we have synarthrosis, amphiarthrosis, and diarthrosis. Synarthrosis, we have no movement, so such as the gomphosis and suture. Amphiarthrosis, a little bit of movement, so pubic symphysis, intervertebral disc. And diarthrosis, freely movable, so like hips, knees, elbows. These are synovial joints for the most part. So again, fibrous joints, no synovial cavity. We have fibrous connective tissue, little or no movement. We have these three types. So here are some pictures. Suture, see very rigid type of connective tissue. Here are those interosseous membranes that are going to form those sheets of fibrous cartilage, and then the gomphosis between the tooth and bone. Cartilaginous joints, so no synovial cavity either. We are articulating with cartilage, and then we have little or no movement. Synarthrosis, symphysis. So synarthrosis again, the epiphyseal plates or growth plates, and pubic symphysis. Synovial joints. We have a synovial cavity. We have the bones covered by articular cartilage, held together with ligaments. We have synovial fluid. There is nerve and blood supply, and we have a capsule. We are allowing a large range of motion at these types of joints. So here, even at the interphalangeal joint, we have a synovial cavity. We have the ability for free movement. So at some joints, especially the synovial joints, we have to have extra cushion and padding because these joints take a lot of abuse. So we have bursa, or tendon sheaths, which are bursa that wrap around the tendons of certain muscles. So bursa are just sac-like structures filled with synovial fluid. Okay, types of movement at synovial joints. We have quite a few. We can see extension and flexion. Here are multiple examples at multiple joints. So flexion is going to bringing a body part closer to the center of the body, so closer to the center of mass, if you will. Extension is moving that body part farther away. So a really good example is going to be the arm and the leg. So flexion of the forearm, we're bringing that forearm closer to the body. Extension, we're getting farther away. Same at the knee. Flexion, we are actually bringing the foot posteriorly, but closer to the center of the body. Extension, we are moving that foot farther away from the body. Lateral flexion is going to be flexion in the lateral plane, so in the frontal plane. A couple other ones are going to be abduction and adduction. So take good care to note ab versus ad. So abduction, we are taking a body part farther away from the side of the body. Adduction, we are bringing that body part closer to the side of the body. So think of abduction just like being abducted. You are being taken farther away. Adduction, you are adding to the body. And you can see multiple examples throughout the body. Circumduction is being able to move a joint in a circular motion. So mostly we see this at the shoulder and the hip joints. Rotation is just going to be able to rotate a body part along a single axis. So rotation of the head. We have lateral and medial rotation, which just means we are rotating the arm laterally or medially. We can do this with the leg as well. Elevation and depression. Good example, we are elevating the jaw. Depression, we are depressing the jaw, so taking it farther away. And then protraction versus retraction. So protraction, we are protruding. Retraction, we are retracting closer to the center line of the body. Inversion and eversion, we see this at the ankle, so the intertarsal joints. Inversion, we are inverting the foot, so bringing the plantar surface of the foot towards the medial portion of the body. Eversion, we are taking that plantar surface of the foot and taking it farther away or laterally. Dorsiflexion and plantar flexion. Dorsiflexion, the dorsal or dorsum of the foot is becoming closer to the center of the body. Plantar flexion, the plantar portion of the foot is getting closer to the center of the body. Supination and pronation. So supination, we are moving the palm anteriorly. Pronation, the palm is moving posteriorly. And then opposition is seen only at the thumb. Okay, you are bringing the thumb and the fifth digit closer to each other. Here is a large table for you to look at to have a better example of what all of these movements mean. Okay, so we have a few different types of joints. Different joints are going to allow different movements. So intertarsal joints, we have more of a plane type of joint. So these bones are going to move only along a certain plane. Then a hinge joint works like the hinge of a door. We see this at the elbow. Pivot joint, so we are pivoting one bone along another. So at the elbow with the radius and ulna. Condyloid joint, so you can see here more like a condyle articulating with a fossa. Okay, saddle joint, it is explained as if you were sitting in a saddle and it's all the ways you can move. So you can move laterally, side to side, or forward and backward. And then we have a ball and socket joint. This is where we get the most free movement seen in the joints.